for my 1005 placement, I actually got placed to 2 different venues because my first venue did not work out, which I will be touching on, and my second venue is where I completed my first year 2-week placement. So my first venue was Gamaraka District Memorial Hospital, which my 2 objectives were to successfully complete a set of observations on a patient and to help assist in ADLs on a patient as well, which I both did. Yet, unfortunately, because of the care that was taken at Gamaraka, I was asked to be replaced as it was not a happy and safe environment for myself or the patients due to just a lot of misuse of care with patients, and it was quite upsetting as there was a lot of mistreating against students, including myself, which I did report on. So that is another unseen objective that I have learnt and that I will grow from. So if it happens in another placement, or if I have any fellow students that I have heard that it is happening to, I am able to assist in helping them report this to the uni and move on from it, as it was a very tough thing to do from what I've experienced. But my second placement was amazing. I was placed at the Lowell McEwen in the pre-admissions clinic. So that is a clinic where people come in pre-surgery and they get all their instructions on fasting and what to do and what not to do, what time their surgery is placed for. It's just for day surgery. Surgeries can obviously prolong to having a couple nights where you have to stay, but I got to learn all the follow through of the surgeries, all different surgeries, why it is important to have pre-admissions, and my 2 objectives were to perform a set of observations as well as not so much ADLs, but to run my own clinic in the observation room, which I did within my 2 weeks there. My objective to run my own clinic was quite successful, as every day I was there I was performing observations on people, so their blood pressure, SATs oxygeration, and their height and weight, which was quite repetitive, but I believe that I have successfully gained that skill in observations. And then to run my own clinic, I was sitting down. I would get my nurse to call the patient in, and I would go through what we were going to do in the observation room, and we had to allow them some time because we had to let them know how many people that else they were going to see. So the anaesthetist, the nurse with the going home instructions, the intern/doctor, and in some cases we did have an orthopedics clinic. We had different types of clinics, so they would have to see the occupational therapist or the physiotherapist. So our clinics had a wide range of medical staff, which was extremely interesting. And I did follow through a patient with a tumour growing out of a hip. So I saw her in the observations rooms where I took observations. I went through to the with her to the doctors. I went through with her to the anaesthetist and the going home instructions, and it was quite informative, as with the anaesthetist we got to go through all the different types of pain medication that she would prefer. So there was a epidural that she could choose from, or there was a form pain relief where they would pop it into an artery and she would have a button that would slowly release the pain medication into. Yet she was a little bit unsure, so she was allowed to sit on it and have a think throughout the day, but there were many side effects with both of them. As the epidural, they said she might not be able to walk for a couple days, as it can last a long time. So, but she was quite determined to get up and walking and to get out of hospital as soon as possible. So she was quite hesitant on that. But when I did go and see her, she did have the epidural, and then she ended up changing to her own form of pain relief, where they give her the button to slowly release it into her stream, so she is able to control how much pain relief she actually gets, which was extremely interesting. Pre-admissions was a really good I believe a really good way to see a lot of different medical procedures. And one of the days, as the pre-admissions is mostly a phone clinic, as it's just done over the phone, only high risk patients come in, which include obesity, a lot of older people who are a little bit more fragile, just a lot of the high risk patients would come in. Yeah, it's mainly phone clinic. So I went to outpatients for a day, which was amazing, and I got to see a lot of different cool clinics, and I sat in and assisted a doctor with sclerotherapy, which is helping deep vein thrombosis and getting rid of spider veins, which was really interesting to see, and I really enjoyed that. So that is the end of my presentation. Thank you.